Hi there, it's Christy with the Chirp YouTube channel. I'm super excited to come to you today to share with you a tool. I have talked in a previous video about teaching your child how to express that a part of her hurts. Well, today I'm here to show you a visual of how that works. So I have a little binder. This is an 8.5 by 5 1/3 or some weird size like that little binder. These are the ones I use for my communication books. And I have a little picture that says hurts. Depending on how advanced your child is, you may put a picture of your child right here with the word my above it, and then put the hurts on the end and have a blank space in between. And what you want to do inside the book is you want to put all sorts of little pictures of body parts. And obviously there are a lot of body parts. I'm sure there are some that I'm missing. I think I noticed one while I was putting this together. Now, just like you require training to be able to use a computer, your child requires some training to be able to efficiently use a communication book. And the way that I recommend that you do that training is first by going through and talking about all the body parts. So you may say, knee. Mommy has a knee. Oh, look, Ella has a knee. So you can talk about it that way. And then you can start pointing out body parts in books that you read. You can find books that specifically label body parts. You might print out pictures and color different body parts different colors just for fun. You might find a page from an old encyclopedia and hang it on the wall, and before bed, just for fun, label body parts. Look at how cute that one is. It's a little butt. I think it's so cute. My pictures are all from a software program called Boardmaker by Meyer Johnson, and I have a link to that down below. You do not have to use these. You can take pictures of your own of these body parts, though if you take a picture of your butt, that might not be such a good idea. You can draw pictures. You can take pictures off the internet. There are programs that have line drawing pictures that you can print, and I have mine printed on cardstock, glued onto construction paper, and then laminated. And they're connected onto this book with Velcro. And in case you choose to use a Velcro-based system, I always put the fuzzy side on the card that's going to be moved, and I always put the pokey side on the thing that's going to remain stable. If you don't do it that way, if you don't have a process, then nothing will ever stick to anything and it just becomes a mess. So make a decision in your head and stick with it. Okay, so we've been teaching body parts. Now we're going to practice. So we have a toy. This is a very special toy. This was my dad's teddy bear when he was a little boy in like 1950. So this thing's pretty awesome. So now we play little owie games with a toy. So I grabbed the little teddy bear, and I used to do this in therapy all the time, and the families thought that I was a sadist because I would bang the little teddy bear's nose on the floor and go, oh no, and the teddy bear would go, wowie, my, and he would cry, and then we would go and we would get the book, and we'd look through here, nose hurts. Nose hurts. Nose hurts. And we'd practice having the toy do what we want the child to do. And then we'd bandage up the toy's nose, or I'd bring some ice packs and put it on, or however we decided, or we just give it kisses. However we decided we wanted to treat the toy's owie, I would have multiple different options available, and then we'd say, what should we do? Should we do ice? Should we do bandage? Should we do kisses? How should we make it all better? And then we would make it all better. And then we would play a little game. It would be the kid's turn to have the bear hurt some part of him. So he might He might bite the bear. What was I thinking? He might bite the bear, and then we have to go and look for a foot. Well, that's something that I'm missing here. I have hands, but not feet. Next time I know I have to put a foot in here. And then he would put, well, I have bear fuzz in my mouth. Gross! Then he would put foot, and we'd go, foot hurts, oh! And then we probably need some ice, because that's how we treat sore feet. So that is how we teach body parts, and not just the labeling, but expressing that something hurts. This is really, really, really important for kids who are minimally verbal or who are just developing verbal language, because we want them to be able to express and practice telling us that things hurt on pieces that we can see on the outside, like our noses, our elbows, our feet, our mouths. We can see if those have an owie. But what if someone's chest on the inside? What if it hurts on the inside? Maybe because the child has asthma. What if a child's stomach hurts? And we can't see that on the outside if they are having an allergic reaction to something digestively. If they have food poisoning. What if they have appendicitis and they don't have a good way to tell us that their stomach hurts? This is really important for teaching kids, because we want them to be able to express what's going on in their body sooner rather than later. And typical kids develop this very, very early, that they point to a piece and say, owie. Kids with developmental diagnoses, kids with social problems and communication delays don't typically develop this as well. They're not usually as effective at communicating it, and sometimes they don't develop it at all unless we specifically teach it. So here's a really good idea for you to do today. Go out and get a book, print up some pictures, and start working on this skill so that your child will be safer and healthier. I hope you have a great day. I'll see you in my next video. Bye.